Good day, everyone. My name is Dr. Mashudu. I am from Mommy Bear Women and Child Clinic. I'm also working at Dr. Mashudu and Medical Partners. I am a medical officer. Today, I'm going to talk to you about HELLP Syndrome. HELLP. HELLP syndrome. So when we talk about HELLP syndrome, we are talking about a condition in severe preeclampsia, whereby there is now hemolysis, there is elevated liver enzymes, as well as low platelet count. So let's talk about what is preeclampsia and bring it down to everybody's understanding. Preeclampsia is when you develop high BP when you are already pregnant and you are above 20 weeks. And this high blood pressure comes with protein in your urine. So the HELLP syndrome is seen, or rather diagnosed, from the HELLP triad, where we found hemolysis or hemolytic anemia, we find elevated liver enzymes, and we also find low platelet counts when we do blood tests. How do you identify this HELLP syndrome if you are pregnant and you want to know, am I also going through the same thing? You will see the following signs. You will have right-sided abdominal pain, more on the upper quadrant. You will struggle with nausea. You will have severe headaches, sometimes blurred vision, as well as body weakness. And when the doctor or the midwife examine you, they are going to find tenderness on the right side of your abdomen. They are going to find high BP or elevated blood pressures, as well as protein in your urine, and some swelling either on your feet that sometimes may go above also to your stomach. So this is the diagnostic criteria. The only time we can say you are having HELLP syndrome is when we have done blood test, and in the blood test there is evidence of hemolysis, and we have checked your liver functions through the blood test, and we find that the liver enzymes are also elevated, and lastly, having low platelet counts. Who are the mummies or pregnant ladies who are at risk of getting HELLP syndrome? Let's talk about age. Women above the age of 34 are also at risk of getting HELLP syndrome. Women who've got many children or who have had multiple pregnancies, as well as white race or Caucasian population and history of poor pregnancy outcomes. These are women who have either had stillbirth, who have had multiple miscarriages, that we refer to as poor pregnancy outcome. Complications of HELLP syndrome that you should look out for, but I hope none of you get to the stage of complications. They can include eclampsia, whereby the mother starts to feed due to all these elevated enzymes, all these changes now starting to affect the brain. There could be something called abruptio placenta, whereby the placenta starts to detach from where it is implanted, and this can cause deficiency in nutrition and oxygen to the baby. There can be DIC, there can also be renal failure, there can be ascites, as well as swelling in the brain as well as in the lungs. Is this HELLP syndrome treatable? Definitely, because there is nothing that goes beyond the doctors. That's why we are here. We can treat it by controlling the blood pressure, making sure that mommy's blood pressure remain normal and well controlled. We can treat it as well by preventing the eclamptic fits. We are going to give treatment that will make mommy to not go into that severe complication. We also treat it by giving the corticosteroids and then fluid therapy, as well as transfusing platelets. So mummies, look out for all the signs and symptoms that I've spoken about, and the moment you pick up any of those, don't hesitate, but run to see your medical practitioner. Thank you.